have any idea what is a fracture? A fracture is a crack or a break in a bone. A fracture occurs when the force exerted to the bone is stronger than the bone can structurally withstand. There are different types of fracture, and that is to be discussed by the next reporters.
Hello everyone, I am Christine Joy B. Silavaria, and I am going to discuss about the different fractures in the bone. As you can see in the screen, we have 9 classifications of bone fractures. First, we have here the normal. And as you all know, normal meaning it does not have any breaks nor cracks in it. Next, we have transverse. The fracture runs horizontally perpendicular to your bone or the opposite direction of your bone. You might see them referred to as complete fractures. This means the line of the break goes all the way through your bone. Transverse fractures usually affect long bones in your body. Next, we have oblique fractures. It occurs when your bone is broken at an angle. The fracture that's angled across the width of your bone. They are usually caused by landing on your bone at an angle after a fall, or when your bone is hit suddenly from an angle, like in a car accident. Next, we have the spiral. They happen when one of your bones is broken with a twisting motion. They create a fracture line that wraps around your bone and looks like a corkscrew. You might see spiral fractures referred to as a complete fractures. Next, we have comminuted fracture. If you have a comminuted fracture, your bone is broken in 2 or more places. Usually, the trauma that causes comminuted fracture creates shatter-like breaks. If you drop a plate, the pieces are never uniformly broken. It's the same with the most comminuted fractures. The term comminuted fracture refers to a bone that is broken in at least 2 places. These fractures can affect any large or long bone in your body. Some of the most common includes the femur or the thigh part. Now, we have the avulsion fracture. An avulsion fracture occurs when a ligament or other soft tissue attachment to bone overcomes the stress capacity of bony attachment and tears off a portion of the bone. Now, we have an impacted fracture. This occurs when 2 pieces of a fractured bone are driven into each other. Because it involves more than a break in the bone, it is more serious than a simple fracture. It takes a significant amount of force to drive 2 fragments of a fractured bone together. Next, we have the fissure. A fissure is a fracture whose walls have been opened significantly by a separation in a direction normal to the plane of the fracture. And lastly, we have green stick fracture. It is a partial thickness fracture where only the cortex and periosteum are interrupted on one side of the bone but remain uninterrupted on the other. They occur most often in long bones including the fibula, tibia, ulna, radius, humerus, and clavicle. That's all for the classifications of fracture. Now let's move on to the next reporter.
Hello everyone, my name is Lordy Ramirez and today I am going to discuss about the closed fracture. Closed fracture, also called as a simple fracture, is one in which a bone is broken but the skin remains intact. Most fractures are considered closed fracture. What are the symptoms of a closed fracture? Sudden pain, swelling, skin redness in the injured area, warmth, bruising, difficult using or moving the injured area or nearby joint. What causes a closed fracture? Closed fractures occur usually when excess force is put on the bone. A twisting, jarring, or bending motion to bones can result in fractures. Causes of closed fractures may include falling, a direct blow or kick to the body, overuse or repetitive motions which tire muscles can put more pressures on the bone and causes stress fracture. What is the treatment for a closed fracture? Treatment for a closed fracture involves putting the bone back in place and keeping it from moving, pain management, time for the bone to heal, preventing complications, restoring formal function. What is a closed fracture? A closed fracture is a type of a broken wrist fracture. It's also called a distal, away from the center of the body, fracture with dorsal angulation and upward angle. A closed fracture is a very painful and serious injury. Go to your nearest emergency department if you suspect you have any type of a wrist fracture. Closed fracture usually occur after a fall on an outstretched hand. When you reach your hand out to catch yourself in a fall, you might land on the small bones that make up your hand and wrist, especially two bones called the lunate and scaphoid. This contact transfer energy to your radius, one of your two arm bones. The end of the radius near your wrist, called the dorsal end, breaks these fractures, which typically happens about an inch away from the end of your radius, causes the broken bone to tilt upward. How common are closed fractures? Closed fractures are very common. They are among the most common breaks that healthcare providers encounter. The radius is the most commonly broken arm bone. Next one is the comminuted fracture. Comminuted fractures are a type of a broken bone. The term comminuted fractures refer to a bone that is broken in at least two places. These fractures can affect any large or long bone in your body. Some of the most common include femur, tibia, fibula, humerus, radius, and ulna, clavicle, and skull. Comminuted fractures are almost always caused by a serious traumas like car accident or fall from a high place. They are very serious in a large bones and you will often need surgery to repair your bones. Sometimes comminuted fractures happen to smaller bones and can heal without surgery. How long it takes to recover depends on which of your bones are fractured and what caused the breaks. Most people needed up to a year to recover from a comminuted fracture if it involved one of the long or larger bone in your body, especially if it requires surgery. Compression fractures are small breaks or cracks in the vertebrae, the bones that make up your spinal column. The breaks happen in a vertebral body, which is the thick, rounded part on the front of each vertebra. Fractures in the bone causes the spine to weaken and collapse. Over time, these fractures affect posture, the spine curves forward, and the person looks hunched over. Compression fractures usually happen in the thoracic middle part of the spine, especially in the lower thoracic area. Provides also call them vertebral. Compression fractures, they often result from osteoporosis, but they can also happen after a trauma, such as car crash or a result of tumors on the spine. Providers treat compression fractures with medications and a special type of back brace. Some people require a minimally invasive procedure to straighten the vertebrae and stabilize their spine.
Hi, I'm Michael Sarol and I'm going to continue to explain the different types of fracture. So first one is the green stick fracture. A partial thickness fracture where only the cortex and periosteum are interrupted on one side of the bone but remain uninterrupted on the other side.
Example of a green stick fracture. So you can see it's not completely broken. This occurs commonly in kids younger 10 years old because their bones are softer and flexible than adult bones. You can treat this fracture with a cast in a few months, it will heal.
Second one is an impacted fracture. An impacted fracture occurs when the broken ends of the bones are impacted or driven into each other.
Here's an example of an impacted fracture, where one fragment of bone goes into another. This fracture happens when in accident or falls. The doctor will use plaster or fiberglass cast to immobilize the broken bone for treatment.
Third is an oblique fracture. Oblique fracture is a type of broken bone They happen when one of your bones are broken at an angle, depending which of your bones is broken.
Here's an example of an oblique fracture. The fracture is diagonal across the bone. This occurs in falls or traumas. You might need a surgery to repair the bone, but some people only need a splint or cast for the bone to heal.
Fourth is the open fracture. An open fracture is also called a compound fracture, in which there is an open wound or break in the skin near the site of the broken bone.
Here's an example of open fracture. In this type, the broken bone tears the skin and it may thus expose the bone for contamination. This occurs on sports injuries and falls or accidents. And for treatment, you'll need a surgery to reline your bones and then a cast to keep them immobilized.
Pot fracture. Pot fracture is a bony injury and fractures around the ankle joint. The cause of pot fracture is usually a result of severe ankle sprain. Pot fracture is a fracture affecting one or both of the melody during activities such as landing from a jump. For example, volleyball, basketball, and badminton, or when you are rolling your ankle. A certain amount of stress is placed on the tibia and fibula at the ankle joint, characterized by the break in the lateral or medial malleolus, one of the bony protrusions of the side of the ankle. So next is the spiral fracture. Spiral fracture, they happen when one of your bones is broken with a twisting motion. Okay? Spiral fracture arises as a result of twisting force applied to the bone. For a long time, such fractures were seen as a particularly suspicious for abuse because for twisting force to be applied, violence from another person was seen as a prerequisite. The last fracture is the transverse fracture. This fracture runs horizontally perpendicular to your bone. You might see them as referred to as complete fracture. This means the line of the break goes all the way through your bones. Transverse fracture usually affects long bones in your body. Cause of transverse fracture is trauma such as car accidents, falls, and other traumatic accidents that can happen to a person. So we will gonna move on to the next topic. Next topic is the medical terminologies related to the skeletal system. So this is the diagnostic and the treatment. First one is the allograft. Allograft. It is a tissue that is transplanted from one person to another. For example, a portion of a liver from a living donor, or a whole portion of a liver from a deceased donor to a recipient of the same species. So in the basic explanation of this allograft is a transplant of an organs or tissues from an individual to another of the same species with a different genotype.
Neoplasia, the surgical breaking down of ankylosis in a joint to permit firm movement, a rare genetic disease characterized by severe generalized joint hypermobility, bilateral congenital hip dislocation, skin hyperextensibility, muscle hypotonia, and mild dysmorphic feature. Aspiration. Aspiration happens when food, liquid, or other materials enters a person's airway and eventually the lungs by accident. It can happen as a person swallow or food can come back up from the stomach. Aspiration can lead to serious health issues such as pneumonia and chronic lung scarring. Autograft. An autograft is defined as the transplantation of tissue from one location to another in the same individual. Chondroitin. Chondroitin is a molecule that occurs naturally in the body. It is major components of cartilage, the tough connective tissue that cushion the joint. Commercial chondroitin comes from the natural sources, such as shark and bovine. Glucosamine is a chemical found in the body. Glucosamine supplements are sold as glucosamine sulfate, glucosamine hydrochloride, and nasatyl glucosamine. Glucosamine is used by the body to make other chemicals that build tendons, ligaments, cartilage, and the fluid that surrounds joints. Joints are cushioned by the fluid and cartilage around them. Taking glucosamine might increase the cartilage and fluid around joints and or help prevent their breakdown. People commonly use glucosamine sulfate and glucosamine hydrochloride for osteoarthritis. Glucosamine is also used for joint pain, rheumatoid arthritis, multiple sclerosis, and many other conditions. But there is no good scientific evidence to support this. A dynamometer is a device that measures an angle or permits the rotation of an object to a defined position. In orthopedics, the former description applies more. The art and science of measuring the joints ranges in each plane of the joint are called gynometry. The term gynometry has its origin from two Greek words, gonia, which means angle, and metron, which means to measure. The first known as a primitive version of the modern day gynometer was by a Dutch physician and mathematician named Gemma Frisius, who used it to calculate and record the position of celestial bodies with respect to Earth. The range of motion is the measurement of movement around a specific joint or body part. To measure the range of motion, doctors, osteopaths, physician therapists, or other health professionals most commonly use a gynometer, which is an instrument that measures angle motion at a joint.
What is iontophoresis? Iontophoresis is a modality used by physical therapists to treat a wide variety of conditions including bursitis, tendonitis or tendinopathy, and to help manage scar tissue. It uses electrical stimulation to help administer medication into your body through the skin. Next, what is laminectomy? Laminectomy is the excision of the posterior arc of a vertebra. Laminectomy is a surgical procedure that removes a portion of a vertebra called the lamina, which is the roof of the spinal canal. What is meniscectomy? Meniscectomy is the removal of the crescent-shaped cartilage or the meniscus of the knee joint. Meniscectomy is a common orthopedic procedure done to alleviate knee pain in the older population with meniscal pathology. It is typically performed on older patients with meniscal tears that are degenerative in nature. What is myelogram? A myelogram is a diagnostic imaging test generally done by a radiologist. It uses a contrast dye and X-rays or computed tomography to look for problems in the spinal canal. What does a myelogram show? A myelogram can detect conditions affecting the spinal cord and nerves within the spinal canal, including disc herniations, bone spurs, spinal stenosis, tumors, and infection. And last, osteoplasty. What is osteoplasty? It is the scraping and removal of damaged bone from a joint. An osteoplasty is a type of surgery performed on the hip joint for the purpose of altering the rim of the socket and or the ball that sits within the joint. It is a successful technique for improving the function of the joint and promoting a fuller range of movement.
Hello everyone, I am Cyril Integrado and I am going to discuss to you prosthesis. So prosthesis is an artificial organ or part of a body. It is a device designed to replace a missing part of a body or to make a part of the body work better. So for example here is we have the artificial leg or breast implant. Now let us proceed to the other treatment. So for the first one, we have here the alkaline phosphatase. So when we say alkaline phosphatase, it is an enzyme needed in the formation of bone. So when we say enzymes, these are proteins that help speed up chemical reactions in our bodies. So here, when you have high levels of alkaline phosphatase or ALP in your blood, it may indicate liver disease or certain bone disorder. So that is for the alkaline phosphatase. Next one is the anthrocentesis. So anthrocentesis is an aspiration of fluid from joint by needle puncture. So it is also called as joint aspiration. So in the arthrocentesis, it is a procedure where a doctor uses a needle to take fluid out of a joint. So when we say joint, these are where two bones meet. So they allow our bodies to move. So these are the hips, the knees, ankles, elbows, shoulders, and knuckles. They are all joints. So next one here is the arthrodesis. So when we say arthrodesis, it is a surgical immobilization or fusion of a joint. So arthrodesis is also referred to as a joint fusion. So the utilizing of two bones at a joint. So this is typically completed through surgery. In simple terms, the orthopedic surgeon manually straightens out the damaged joint. So he removes the cartilage and then stabilizes the bone so that they heal together. That is for the arthrodesis. So next one here is the arthroplasty. When we say arthroplasty, it is a partial or total replacement of a joint with a prosthesis. So here, the damaged cartilage of bone is removed from your joint and replaced with prosthetic components made of metal, plastic, or ceramic. So that is for the arthroplasty.
Arthroscopic surgery is a minimally invasive procedure that is used to treat various problems of the joints. Arthroscopy is generally done on an outpatient basis and is commonly used for the treatment of the knee and shoulder joints, repairing cartilage and meniscus problems in the knee. Common arthroscopic procedures include repairing and trimming a torn meniscus, repair of the rotator cuff, treatment of the cartilage damage in the knee, treatment of the lobular tears in the shoulder. Arthroscopic surgery is a less invasive procedure and is often very successful. Even though rare, the arthroscopy procedure is still a surgery, and all surgeries do have some risks such as infection, blood clots, and etc. Next is discectomy. A discectomy is done to relieve a pressure of herniated disc, also called sleep ruptured or disc relapse, places on the spinal nerve. A herniated disc occurs when some of the softer material inside the disc pushes out through a crack in the outer lining of the disc. Discectomy surgery removes the damaged part of the disc in the spine that has its soft center pushing out through the tough outer lining. A herniated disc can irritate or press on nearby nerves. Discectomy works best for treating pain that travels down the arms or legs from a compressed nerve. The procedure is less helpful for treating the pain that's felt only in the back or neck. Most people who have back pain or neck pain find relief with other treatments such as weight loss, arthritis medication, or physical therapy. A healthcare provider might suggest discectomy if other than surgical treatments have not worked or if symptoms worsen. There are several ways to perform discectomy. Many surgeons prefer minimally invasive discectomy, which uses small incisions and a microscope or tiny video camera for viewing the procedure. Orthopedics, also known as the orthopedic surgery, is a branch of medicine that focuses on the care of the skeletal system and its interconnecting parts. These parts include the bones, muscles, joints, tendons, ligaments, and the nerves. Orthopedic condition may be present from birth or they may result from an injury or age-related. There are generally two types of orthopedists, surgical and non-surgical. The former are called orthopedic surgeons, while non-surgical orthopedists includes physiatrists and physical medicine and rehabilitation specialists. An orthopedist often works as a part of a larger orthopedic treatment team. This team may include physician assistant, nurse practitioners, occupational and physical therapists, and athletic trainers. When people break bones, often surgery isn't needed to repair them. Instead, the doctor can realign the bones and set them in a place with a cast to heal correctly. This procedure is called close reduction, and casting, and it's one of the most common treatment methods for broken bones. Lastly, traction. Traction refers to the practice of slowly and gently pulling on the fractured or dislocated body part. It is often done using ropes, pulleys, and weights. These tools help apply the force to the tissues surrounding the damaged area. The purpose of traction is to guide the body part back into place and hold it steady. Traction may be used to stabilize and realign bone fractures, such as broken arm or leg. It may also help reduce the pain of a fracture before surgery. It can treat bone deformities caused by certain conditions such as scoliosis. It can correct stiff and constricted muscles, joints, tendons, or skin. It also stretches the neck and prevent painful muscle spasm. The two main types of traction are skeletal traction and skin traction. The type of traction used will depend on the location of the nature of the problem. Skeletal traction is most commonly used to treat fractures of the femur or thigh bone. It's also the preferred method when greater force needs to be applied to the affected area. Skin traction is used when the soft tissues such as the muscles and tendons needs to be repaired. Less force is applied during the skin traction to avoid irritating or damaging the skin on other soft tissues. So that's it, the different types of fracture and different treatments. We hope you understand and learned something. Thank you for watching.